Hello, my name is Brittany Strickland, and I chose to do my video on treating substance abuse disorders with MAT, which is medicated assisted treatment. First off, I want to start by explaining what substance abuse disorder is and what MAT is, medicated assisted treatment. Substance abuse disorder is basically addiction, any kind of addiction to any kind of substance, which can be alcohol, marijuana, opiates, which is any type of pain medication. And when we're referring to opiates, it is sometimes called OUD, which is opiate use disorder. Medicated assisted treatment is a type of treatment which is usually outpatient treatment, where the patient usually goes to the facility, the doctor's office, which starts out every day, and they are prescribed medication. There's three types of medications they use to treat opiate disorders. One's methadone, one's called buprenorphine and naltrexone. The first two I mentioned are actual opiates or opioids, which brings me to why there is such a stigma associated with medicated assisted treatment. And like I said, in medicated assisted treatment, usually the patient goes every day. They go in, they get dosed by whatever medication the doctor sees fit to treat their substance use, whatever their substance was. Usually they start out going in every day, and every clinic is different. They have rules. If you follow these rules and you stay clean and you stay sober, you'll eventually move up to what they call take homes. And take homes is when you get to bring your medication home for the day, so you don't have to go into the clinic and dose that day. Medicated assisted treatment is FDA approved. It's evidence based. There's been many studies on it, but because there's so many different types of treatment out there, and the world is so uneducated, and they don't quite understand medicated assisted treatment, people view it as negatively. They especially the people, like I said, there's different types of treatment. I'm pretty sure you all heard of inpatient treatment, which is like different types of rehabs. There is different kinds of outpatient treatment where no medication is dispensed, and it's really honestly just counseling, just therapy sessions. But with pertaining to opioids and opioid use disorder, which is what I focused on, because there is an actual physical withdrawal from pain medication, in my opinion, is why abstinence, going without any kind of medication, does not work, because of the physical withdrawals. And because there's so many different types of treatment, a lot of people would believe different ways. People that believe in rehab, they usually believe in what I just referred to as abstinence, which is medication-free treatment, where you go in and you basically detox. You go a certain amount of days without no kind of medication. You go through the physical withdrawals, and a lot of those inpatient treatment facilities will hold you for about 7 to 10 days. And then after you're released, you could go home, you could go to a halfway house or whatever you chose to do. But after you're released is when you don't necessarily have the physical withdrawals no more, but you start to have cravings. And there's so many steps and so many things that one needs to change when they're in active addiction, say for instance they go to a in-house rehab, they get out there 17 days because they feel like they're no longer sick and they're over it, or they're, you know, no longer addicted. They go out and they go back to the same people, places, and things, what they refer to, with the same friends, and they're using. It's going to be hard to not use with them. But like I said, even the professional people that work, the nurses, doctors, and all that work in a medicated assisted treatment facility, they also are judged. They have to deal with the stigma associated with that. A lot of people that don't agree with the MAT, they believe one should go at should just go without any kind of medication, because they look at medicated assisted treatment as actually substituted one drug for another, because like I said, the first two medications I called out, methadone and the buprenorphine, however you say it, they are actually considered an opioid, and if they are not prescribed correctly and administered correctly, they can become addicting. So that is one of the main problems that is associated. And another thing that I have found in some research is that a lot of people actually don't consider substance abuse to be an actual disorder, even though it is it is it is in the DSM, which is the Diagnostic and Statistic Manual, and the IDC, which is the International Classification of Disease. So it is classified as a disease or a disorder, but a lot of people, because they are, like I said, uneducated, they don't understand the physical withdrawals that come from opiate disorder. So they are quick to judge. They're quick to say, well, why don't you just go without? But if the world, or if, you know, America was to take the time to just educate more on MAT, some statistics I found was that over 2 million people in the U.S. Are addicted to some type of opioid. Studies have found that methadone and buprenorphine are safe and effective treatment for opioid disorder, and it improves treatment retention. When I say treatment retention, I'm referring to sober time after leaving a facility. Up to 90% of individuals who use medicated assisted treatment, they maintain sobriety for up to 2 years. It is proven to be a high success rate than going with abstinence. It's proven to have a higher success rate than just going without any medication at all. And like I said earlier, MAT is it evidence-based therapy or treatment. And when individuals or patients choose that type of treatment, they, like I said, 90% of the time have a longer success rate. They stay sober, because the relapse rate in addiction is like so high. 9 times out of 10, when someone goes to any kind of treatment facility, they are going to relapse, because there's so many different things that you have to learn and you have to stick to, you have to stay by, in order to stay clean. Because when you are in active addiction, it is a whole lifestyle. It consumes you. It changes your brain pattern. It changes your way of thinking. So when one goes to treatment, they need to not just focus on the with the physical withdrawals and going, you know, without getting sick. They also need to focus on the therapy part and changing their ways and their actions. That's why I feel like everybody treatment, the same type of treatment is not going to work for everyone. That's why I feel like America should educate on medicated assisted treatment. Thank you.